What are the key differences between zoonotic and non-zoonotic diseases, and how should veterinary nurses implement biosecurity measures to prevent the transmission of zoonotic diseases in a veterinary clinic? Answer: zoonotic diseases are those that can be transmitted from animals to humans, whereas non-zoonotic diseases are limited to animals and cannot be transmitted to humans. Zoonotic diseases are a significant concern in veterinary practices due to the potential risk to public health. To prevent transmission, veterinary nurses should adhere to biosecurity measures such as use of personal protective equipment (PPE). Nurses should wear gloves, masks, gowns, and face shields when handling potentially infected animals. Hand hygiene, thorough washing and sanitizing of hands after handling animals or contaminated materials is crucial to prevent cross-contamination. Isolation protocols. Infected animals should be isolated from healthy animals to minimize exposure. Separate equipment should be used for infected and healthy animals. Cleaning and disinfection. Disinfectant protocols for surfaces and equipment that have come into contact with animals should be followed. Vaccination and health screening. Regular vaccination of animals, especially those in contact with humans or other animals, helps reduce the spread of zoonotic diseases. Describe the role of herd immunity in veterinary nursing, especially in managing vaccination protocols in a group of animals. Why is herd immunity critical for controlling infectious diseases in animal populations? Answer: herd immunity refers to the protection from infectious diseases that occurs when a high proportion of a population is immune, either through vaccination or prior infection. In veterinary settings, herd immunity plays a pivotal role in preventing the spread of infectious diseases within animal populations, particularly in areas with close animal contact, such as farms or shelters. In veterinary nursing, ensuring herd immunity involves vaccination protocols, administering vaccines according to the recommended schedule for different species. This includes ensuring that animals receive their primary vaccines and booster shots, monitoring immunity levels, regular health checks to determine if animals have sufficient immunity, especially in herds with a history of outbreaks, education, educating animal owners about the importance of vaccinating all animals to achieve community-wide immunity. Herd immunity is especially critical for diseases with high morbidity and mortality rates, such as rabies or distemper. By maintaining a vaccinated population, veterinary nurses help reduce the likelihood of outbreaks and prevent diseases from spreading. Mrs. Dawson is the owner of a kennel that has recently experienced a respiratory disease outbreak among the dogs in her care. Several dogs have developed symptoms of coughing, nasal discharge, and lethargy. She is concerned about the health of the other dogs and asks for your advice. What steps should Mrs. Dawson take to ensure that the disease does not spread further, and how should she isolate the infected animals? Answer: Mrs. Dawson should follow the following steps to prevent the further spread of the respiratory disease in her kennel. Isolation. All symptomatic dogs should be immediately isolated in separate enclosures to prevent the disease from spreading to healthy animals. These dogs should be handled last during care rounds. PPE use. Ensure that staff wear appropriate PPE, gloves, masks, gowns when handling the infected dogs, and clean their hands thoroughly between interactions with different animals. Disinfection protocols. Thoroughly disinfect all surfaces, kennels, bedding, and equipment that the infected dogs have come into contact with, using appropriate veterinary disinfectants that are effective against respiratory pathogens. Veterinary care. Consult with a veterinarian to confirm the diagnosis and determine whether any infected dogs need supportive care or specific treatment for the disease. Monitoring and quarantine. Any new arrivals to the kennel should be quarantined for 14 days to ensure they are not carriers of the disease. All dogs should be monitored for symptoms. Explain the role of disinfection in infection control within veterinary clinics. How do veterinary nurses ensure that disinfectants are used effectively, and what factors influence the efficacy of disinfectants? Answer: disinfection is a crucial part of infection control in veterinary clinics as it helps eliminate harmful pathogens from surfaces, equipment, and the environment, reducing the risk of disease transmission. To ensure that disinfectants are used effectively, veterinary nurses should choose the right disinfectant. Disinfectants should be selected based on the type of pathogens, bacteria, viruses, fungi they are intended to eliminate. It's important to use hospital-grade disinfectants with broad-spectrum activity against the likely pathogens. Follow manufacturer instructions. Veterinary nurses should adhere to the instructions on the disinfectant label, including dilution rate, contact time, and usage instructions. Surface preparation. Before applying disinfectant, surfaces should be cleaned of organic matter e.g. dirt, debris that could reduce the disinfectant's effectiveness. Correct application. Disinfectants should be applied evenly to surfaces and left for the recommended contact time to ensure full efficacy. Factors influencing disinfectant efficacy include concentration. Too diluted or too concentrated disinfectants may be ineffective. Contact time. Some disinfectants require specific contact times to kill pathogens. Temperature and pH. Some disinfectants may work better at specific temperatures or pH levels. Relevant guidelines. Australian Infection Control Guidelines for Veterinary Clinics. Guidelines for cleaning and disinfecting animal care facilities. World Health Organization (WHO). Infection control protocols in healthcare environments. In neonatal care, what is the importance of proper thermal support for newborn animals, and what are the potential risks if thermal support is inadequate? Answer: proper thermal support for neonatal animals is critical as they are unable to regulate their body temperature effectively in the first few days of life. Insufficient thermal support can lead to hypothermia, which can cause a range of complications, including impaired immune function, feeding difficulties, and even death. The importance of thermal support includes maintaining body temperature. Newborns require an ambient temperature of 28 to 30 in the first few days of life. A stable environment ensures that their body temperature remains within a safe range for optimal growth and development. Promoting metabolism and feeding. Cold stress can lead to reduction in metabolic rate, affecting the newborn's ability to feed and absorb nutrients effectively. Preventing hypoglycemia. Hypothermia can cause a drop in blood glucose levels, which may result in lethargy and poor feeding. Inadequate thermal support can result in reduced immune response. Hypothermic animals are more susceptible to infections and diseases. Respiratory distress. Inadequate warmth may lead to breathing difficulties, making it harder for neonates to survive. Relevant guidelines. Veterinary neonatal care guidelines. Recommendations for temperature control and care of neonates. National animal welfare standards. Ensuring proper environmental conditions for neonatal care. Discuss the process of breeding management in veterinary nursing. What are the most common reproductive disorders that affect female animals during breeding, and how should they be managed? Answer: breeding management in veterinary nursing involves ensuring that both male and female animals are healthy, in the right condition, and free of diseases before breeding. This includes pre-breeding health check, assessing the health of both the sire and dam, ensuring they are free from infections and reproductive diseases. Estrus monitoring, monitoring the female's estrus cycle to determine the optimal time for breeding using both physical signs, e.g. swelling of the vulva, and hormonal testing. Artificial insemination (AI). If natural breeding is not possible, AI may be used, requiring veterinary nurses to assist with semen collection, handling, and insemination procedures. Common reproductive disorders affecting females include pyometro, a life-threatening uterine infection that often requires emergency treatment or surgery. It can occur after estrus or parturition and is treated with antibiotics, or in severe cases, hysterectomy. Mastitis, infection of the mammary glands, often due to poor hygiene during or after lactation, treated with antibiotics and proper milking techniques. Dystocia, difficulty during labor that may require veterinary intervention such as manual assistance or cesarean section. Explain the importance of proper vaccination protocols in controlling infectious diseases in a veterinary clinic. How should veterinary nurses ensure that vaccination records are accurately maintained and updated? Answer: proper vaccination protocols are critical in controlling infectious diseases within veterinary clinics by preventing the spread of diseases among animals, especially those that are highly contagious or life-threatening. Veterinary nurses ensure the following: adherence to vaccine schedules. Vaccinations should be administered according to the recommended schedules, considering the animal's age, breed, and risk factors for diseases. Record keeping. Accurate vaccination records should be maintained for each animal, noting the type of vaccine, date of administration, and any adverse reactions. These records help ensure animals receive timely booster doses and track their immunity status. Owner education. Educating pet owners about the importance of keeping up with vaccinations and maintaining proper documentation is also crucial for long-term disease control. Relevant guidelines. World Health Organization (WHO). Guidelines for vaccination schedules and monitoring. Australian Veterinary Association (IVA). Protocols for managing vaccination programs. Describe the key considerations in postpartum care for dams and neonates. How do veterinary nurses support both the mother and the newborn during the critical period after birth? Answer: postpartum care for dams and neonates is essential to ensure the health and well-being of both. For the dam, key considerations include Monitoring for complications. Veterinary nurses must observe for signs of postpartum hemorrhage, uterine infection, or mastitis. Nutrition, ensuring the dam has access to high-quality food and clean water to support lactation and recovery. Rest, providing a quiet, clean, and comfortable environment to allow the dam to recover. For neonates, considerations include temperature regulation. Neonates are vulnerable to hypothermia and need a warm environment as their thermoregulatory system is underdeveloped. Nutritional support, ensuring the neonate receives sufficient colostrum, which contains vital antibodies, within the first few hours of life. If the dam is unable to nurse, veterinary nurses may need to assist with bottle feeding. Monitoring for disease. Neonates should be monitored for any signs of infection or congenital disorders that may arise. What are the key factors that influence the development of a disease outbreak in a veterinary clinic, and how should veterinary nurses intervene early to prevent widespread transmission? Answer: key factors influencing the development of a disease outbreak in a veterinary clinic include poor infection control, lack of strict hygiene practices including inadequate cleaning of surfaces, equipment, and hands, high animal density. Crowded conditions increase the likelihood of pathogen transmission, especially in kennels, shelters, or farms. Inadequate isolation of sick animals. Failure to isolate infected animals promptly increases the risk of cross-contamination. Veterinary nurses can intervene early by implementing biosecurity measures, ensuring strict hand hygiene, wearing PPE, and maintaining isolation for sick animals, identifying early symptoms, vigilantly monitoring animals for early signs of illness and isolating symptomatic animals immediately. Prompt diagnosis and treatment. Seeking veterinary assistance for a prompt diagnosis, starting quarantine procedures and following treatment protocols. Explain the significance of reproductive physiology in managing breeding animals, and how do veterinary nurses assist in the care of both male and female breeding animals to ensure optimal reproductive success? Answer: reproductive physiology is the study of the reproductive system's function, which is vital for managing breeding animals. Understanding the reproductive cycles of both males and females is essential for optimal breeding success. For female animals, key aspects include estrus cycle monitoring, recognizing the signs of estrus and determining the best time for breeding. Veterinary nurses assist by observing behavioral changes, monitoring hormonal levels, and ensuring the female is in optimal health. Pregnancy detection. Early detection of pregnancy through ultrasound or other diagnostic methods allows for early intervention if needed. For male animals, considerations include sperm quality, monitoring sperm motility and morphology in breeding males. Veterinary nurses may assist in semen collection and preservation techniques for artificial insemination. Health management, ensuring male animals are free of sexually transmitted infections and other reproductive diseases. Describe the key steps involved in performing a thorough physical examination on a dog presented with lethargy and poor appetite. What are the critical signs to look for, and how do they influence your diagnosis and treatment plan? Answer: a comprehensive physical examination begins with a detailed history including the onset, duration, and progression of symptoms such as lethargy and poor appetite. The veterinarian or veterinary nurse should begin by observing the patient's overall condition and posture. Critical steps include inspection. Observe for abnormal body conditions, signs of dehydration, and physical abnormalities like swelling, lesions, or asymmetry. Palpation. Assess for pain, heat, swelling, or abnormalities in organs such as the liver or spleen. Check for lymph node enlargement, which could indicate infection or systemic illness. Auscultation. Listen for abnormal heart sounds or lung noises that may indicate respiratory or cardiovascular issues. Vital signs assessment. Measure temperature, pulse, respiratory rate, and blood pressure. The absence of normal, vital signs or abnormal readings can point to severe systemic conditions. Neurological examination. Check for reflexes, coordination, and responsiveness to assess any central nervous system abnormalities. You have just taken the vital signs of a dog and recorded a body temperature of 39.5 Dec, 103.1 Dec, a heart rate of 110 BPM, and a respiratory rate of 30 breaths per minute. What do these readings indicate, and what are the next steps in assessing the dog's condition? Answer: the elevated body temperature, 39.5 Dec, is considered hypothermic, suggesting that the dog might be experiencing an infection, inflammation, or other systemic issues. The normal range for a dog's body temperature is 38 deg to 39.2 deg, 101 deg to 102.5 deg. So this reading is above the threshold for fever heart rate. A rate of 110 bpm is higher than the normal range for dogs, which is typically 60100 bpm, suggesting tachycardia often associated with fever, stress, or pain. Respiratory rate. A respiratory rate of 30 breaths per minute is on the higher end of the normal range, 1030 breaths per minute, possibly indicating distress, fever, or respiratory involvement. Given these vital sign abnormalities, the next step should be to conduct further diagnostic tests such as blood work, urinalysis, and possibly imaging to identify the underlying cause of the fever and tachycardia, such as an infection or inflammatory disease. Mr. Harris has brought in his cat Whiskers for a routine checkup. During the examination, the veterinary nurse observes that Whiskers' heart rate is unusually high at 180 bpm with a respiratory rate of 40 breaths per minute. These vital signs are accompanied by lethargy and a lack of appetite. The nurse proceeds with a CG, which shows an abnormal heart rhythm. What steps should the nurse take next, and how should they approach this case? Answer: the elevated heart rate, tachycardia, and respiratory rate combined with lethargy and lack of appetite suggests that Whiskers may be experiencing a systemic issue such as a cardiac or respiratory condition. The CG revealing an abnormal heart rhythm indicates the need for urgent attention to cardiovascular health. The nurse should ensure stabilization, make sure the cat is calm and at ease as stress can exacerbate tachycardia and respiratory distress. Review ECG findings. Analyze the ECG to determine if the abnormal rhythm is related to arrhythmia or other cardiac disturbances. Monitor vital signs. Reassess the cat's vital signs, including heart rate and respiratory rate, regularly to detect changes. Consult with the veterinarian. Present the findings to the veterinarian for a more thorough workup, including blood work to evaluate electrolyte levels, liver and kidney function. Prepare for emergency care if needed. If the ECG suggests a life-threatening arrhythmia or other cardiac pathology, the nurse should be prepared to administer medication or assist in procedures as directed by the veterinarian. A dog suddenly presents with labored breathing, cyanosis around the gums, and a heart rate of 150 bpm. The veterinary nurse suspects an acute respiratory event. What immediate actions should the nurse take, and what interventions may be required? Answer: the acute symptoms of labored breathing, cyanosis, blue gums, and tachycardia indicate severe respiratory distress and potential hypoxia. Immediate intervention is crucial. The nurse should ensure airway patency. Assess the airway to ensure it is open and clear of obstructions. If the dog is choking, perform appropriate first aid. Oxygen therapy. Administer supplemental oxygen using an oxygen mask or cage to assist with breathing and improve oxygen saturation. Monitor vital signs. Continuously monitor the heart rate, respiratory rate, and oxygen saturation levels using a pulse oximeter. Prepare for emergency interventions. The veterinarian may need to intubate the patient or perform diagnostic tests such as radiographs to assess the cause of the respiratory distress, e.g. pneumonia, heart failure, or a collapsed lung. IV access and fluid support. Establish intravenous access to administer fluids and medications to stabilize the patient, especially if shock is suspected. Explain the differences between a randomized controlled trial, or ET, and a cohort study. How do the results from each study design contribute to evidence-based veterinary nursing practice? Answer: randomized controlled trial, or ET. An RCT is a type of clinical trial in which participants are randomly assigned to different treatment groups. This design minimizes bias and allows for a high level of control over confounding variables. RCTs are often considered the gold standard in research due to their ability to establish cause and effect relationships. Cohort study. A cohort study involves following a group of individuals over time to observe outcomes. It can be either prospective, following subjects forward in time, or retrospective, looking at past records. While cohort studies can demonstrate associations between variables, they do not prove causation as effectively as RETS. In evidence-based veterinary nursing, both designs have their roles. RCTs provide strong evidence for treatment efficacy, while cohort studies can be valuable for observing long-term outcomes in specific populations or diseases. You are reviewing a veterinary research article that investigates the effects of a new antibiotic on canine respiratory infections. The study includes a small sample size and lacks a placebo group. What are the potential weaknesses of this study, and how would these limitations affect the reliability of the results? Answer: the primary weaknesses of this study are small sample size. A small sample size reduces the statistical power of the study, increasing the risk of type I and type I errors, false positives, and false negatives. The findings may not be generalizable to the broader population of dogs with respiratory infections. Lack of a placebo group. Without a placebo group, it is difficult to isolate the effect of the antibiotic from other variables, such as the natural progression of the disease or the impact of other treatments. This compromises the internal validity of the study. These limitations suggest that while the study may offer preliminary insights, the results should be interpreted with caution. Further research with larger sample sizes and appropriate control groups is needed to confirm the antibiotic's efficacy. What are the main differences between a general physical examination and a systems-based physical examination in veterinary nursing? Why might a systems-based approach be preferred in certain situations, and how would it benefit the assessment of a complex case? Answer: in veterinary nursing, a general physical examination (P) and a systems-based P serve different functions in patient assessment. A general P offers an overview of the animal's health, quickly assessing major systems like cardiovascular, respiratory, gastrointestinal, and musculoskeletal. This approach is useful for initial assessments or routine checkups as it provides a broad view in a limited time. However, the systems-based P is much more detailed, assessing each system, e.g., cardiovascular, respiratory, neurological individually. Its systematic focus is highly beneficial in cases of complex or multi-system conditions where symptoms might be subtle or overlap across systems. In a systems-based examination, the nurse can thoroughly evaluate each body system, identifying specific issues within each that may contribute to the patient's overall health problem. This method helps to develop a comprehensive understanding of complex cases and detect comorbidities that could be missed with a general PE. For instance, an older dog presenting with weight loss and lethargy may be suffering from several concurrent issues such as kidney disease and arthritis. A systems-based examination could provide clear evidence of each, allowing for targeted interventions. Emma, a veterinary nurse, is monitoring Max, a 7-year-old Labrador, during surgery. Midway through the procedure, Max's heart rate increases suddenly and his blood pressure drops. Describe Emma's immediate actions, the possible reasons for these changes, and the significance of monitoring these parameters during surgery. Answer: Emma's immediate response should include checking Max's anesthesia depth, as a sudden increase in heart rate, tachycardia, coupled with a drop in blood pressure, hypotension, could indicate inadequate anesthesia, pain, or stress response. She should review the anesthesia machine and all parameters, including oxygen and gas flow rates, to ensure proper function. If the anesthesia seems correct, Emma should alert the veterinarian to investigate possible causes such as blood loss or a drug reaction. Monitoring vital signs throughout surgery is crucial. It provides real-time data on the patient's physiological state and helps prevent complications. These changes in heart rate and blood pressure could indicate an adverse reaction to anesthesia, hypovolemia from blood loss, or shock. Surgical monitoring protocols recommend continuously tracking these parameters to prevent conditions like hypoxic damage, organ dysfunction, or cardiovascular collapse. Adjustments to fluid therapy, anesthetic depth, and analgesia might be needed. Emma's actions demonstrate a critical understanding of intraoperative monitoring, emphasizing prompt responses to deviations in vital signs to maintain the patient's stability and prevent long-term complications. When assessing a feline patient's vital signs, you note a rapid and shallow respiratory pattern, pale mucous membranes, and weak peripheral pulses. Explain the possible underlying conditions these signs might indicate and the immediate nursing interventions that should be initiated. Answer: these symptoms in a feline patient suggest possible underlying issues such as hypovolemic shock, severe anemia, or respiratory distress. Rapid, shallow breathing can occur when oxygen intake is insufficient or when blood flow is compromised, often leading to pale mucous membranes and weak pulses as circulation to extremities is reduced to preserve blood flow to vital organs. Hypovolemic shock might result from blood or fluid loss due to trauma, while anemia could arise from bleeding disorders or internal hemorrhage. Respiratory distress may indicate airway blockage, pleural effusion, or severe pulmonary conditions. The immediate interventions should include supplemental oxygen therapy to support respiratory function and address hypoxemia. Establishing IV access is crucial to provide fluids, stabilize blood pressure, and maintain hydration if hypovolemia is suspected. Continuous monitoring of heart rate, blood pressure, respiratory rate, and mucous membrane color is necessary to assess response to interventions and guide further treatment. Additionally, diagnostics such as blood work or imaging may be required to confirm the underlying cause. Recognizing and addressing these symptoms promptly aligns with emergency care protocols to prevent deterioration and support recovery. In a postoperative canine patient, you observe a sudden increase in respiratory rate, restlessness, and vocalizations. What are the possible complications these symptoms might indicate, and how should you prioritize your nursing interventions? Answer: the sudden onset of increased respiratory rate, restlessness, and vocalizations in a postoperative canine patient likely indicates either pain or hypoxemia, both common complications after surgery. The patient may be in discomfort if the analgesic protocol is inadequate, leading to symptoms like agitation and increased respiration as pain intensifies. Alternatively, these symptoms could also signal inadequate oxygenation, which could result from hypoventilation or airway obstruction due to anesthesia. To manage these symptoms, the nursing intervention should prioritize assessing oxygen saturation levels using pulse oximetry and providing supplemental oxygen if necessary. It's also essential to review the patient's analgesia record, as pain control is crucial for a stable recovery. If pain is suspected, consulting with the veterinarian to adjust the pain management plan may be necessary. Consistent monitoring and patient reassessment are vital, as unaddressed distress can increase complications and prolong recovery. Effective postoperative monitoring is essential to prevent complications and ensure patient comfort and stability. Dr. Jacobs, a veterinarian, wants to implement a new wound treatment that was shown to have a positive effect in a recent case study. As a veterinary nurse, what should you advise Dr. Jacobs about the strength of evidence provided by a case study and the considerations before applying it in broader practice? Answer: a case study offers valuable insights, but is typically seen as low-level evidence because it lacks the rigor and generalizability of larger controlled studies. While the treatment's positive effect in one case may suggest its potential, it's not sufficient to conclude that the treatment will work similarly in all patients. Case studies are anecdotal and may not control for all variables, limiting their reliability and applicability to a larger population. It would be prudent to advise Dr. Jacobs to consider higher-level evidence, such as results from randomized controlled trials or meta-analyses if available, before implementing this treatment widely. Additionally, patient-specific factors such as species, age, and health status should be carefully evaluated, as they can significantly affect treatment efficacy. Suggesting further research, perhaps by conducting a small-scale trial with control measures in place, would support the application of evidence-based practices and help reduce potential risks to patients. Caution in adopting new treatments ensures adherence to best practices and patient safety. Describe the role of clinical guidelines in evidence-based veterinary nursing and how a veterinary nurse should utilize these guidelines when formulating a patient care plan. Answer: clinical guidelines in veterinary nursing are systematically developed protocols that summarize the best available evidence to provide standardized recommendations for patient care. These guidelines are created by expert panels based on research and clinical expertise to optimize patient outcomes and ensure consistency in care practices. For example, guidelines for postoperative pain management in cats would include standardized dosing recommendations for analgesics, monitoring practices, and protocols for early detection of pain symptoms. A veterinary nurse should use these guidelines as a framework for care plans, adapting them as necessary for each patient's unique condition and needs. Guidelines should be followed closely, but individual factors, such as a pet's breed, age, or underlying health conditions, may require specific modifications. If deviations from guidelines are necessary, these should be documented along with a rationale, both for transparency and legal compliance. Utilizing clinical guidelines in practice supports a high standard of care, enabling nurses to provide treatments aligned with current evidence-based recommendations while addressing the unique circumstances of each patient. Explain the process and key considerations involved in safely administering chemotherapy to a veterinary patient. Include the safety protocols that must be followed for both the patient and the clinical staff. Answer: administering chemotherapy requires meticulous attention to safety to protect both the patient and clinical staff from hazardous exposure. Key considerations include personal protective equipment (PPE). Staff must wear appropriate PPE, including chemotherapy-tested gloves, gowns, masks, and eye protection. The PPE prevents exposure to toxic agents through skin contact, inhalation, or accidental ingestion. Preparation in a ventilated hood. Chemotherapy drugs should be prepared in a biologic safety cabinet (BSC) to contain airborne particles. Safe drug handling. Use closed system transfer devices and Luolock syringes to prevent leaks or spills. The chemotherapy drugs must be double-checked for accuracy, concentration, and volume to avoid dosing errors. Disposal protocols. Waste from chemotherapy treatments, including gloves and syringes, must be disposed of in designated hazardous waste containers. Some drugs require specific neutralization before disposal. Patient restraint and monitoring. The animal should be appropriately restrained to prevent sudden movements that could cause drug spillage. Additionally, careful monitoring of the patient's vital signs during administration is critical to detect any adverse reactions immediately. Describe the stages of cancer in veterinary patients and discuss how these stages influence treatment options and prognosis. Answer: cancer staging in veterinary medicine is typically classified from stage 0 in situ to stage IV metastatic, influencing treatment and prognosis. Stage 0 in situ, the cancer is localized and has not invaded surrounding tissues. Surgical removal is often curative at this stage with a good prognosis. Stage I, the tumor is still localized but may be larger or more invasive within the origin tissue. Surgery remains a primary treatment, often coupled with chemotherapy or radiation if margins are not clear. Stidham and 2 cancer begins to spread to nearby lymph nodes. Treatment becomes more aggressive, often involving a combination of surgery, chemotherapy, and potentially radiation therapy. Stidham and the cancer has spread extensively to regional lymph nodes. At this stage, chemotherapy becomes a primary treatment, aiming to control tumor spread, though the prognosis is more guarded. Stage IV, metastatic. Cancer has spread to distant organs or tissues. Treatment is typically palliative, focusing on the quality of life as the prognosis is poor. Dr. Patel is working with a client whose dog Max has been diagnosed with lymphoma. Max's owner is concerned about the side effects of chemotherapy and is hesitant to proceed. What steps should Dr. Patel take to address these concerns while adhering to ethical guidelines in veterinary care? Answer: Dr. Patel should engage in a compassionate, transparent discussion with Max's owner to address concerns about chemotherapy side effects. Key steps include educating the owner, explain the potential benefits of chemotherapy, such as prolonged quality of life, and the specific side effects related to lymphoma treatments, including nausea, immune suppression, and fatigue. Presenting alternatives. Discuss possible alternatives, such as palliative care, that may manage symptoms if chemotherapy is not pursued. This empowers the owner to make an informed decision. Discussing supportive care. Emphasize supportive care options to mitigate side effects, such as anti-nausea medication, to improve Max's comfort during treatment. Offering a trial approach. Suggest a limited trial of chemotherapy to assess Max's tolerance, allowing the owner to see firsthand if the side effects are manageable. Ethical guidelines emphasize informed consent, transparency, and respect for the client's autonomy in decision-making. In what ways can veterinary nurses contribute to stress reduction in hospitalized animals, and what are the long-term welfare benefits of such practices? Answer: veterinary nurses can play a vital role in reducing stress for hospitalized animals by implementing welfare-centered practices, enclosure modification, provide comfortable bedding, minimize noise, and ensure a safe environment with visual barriers to reduce exposure to other animals. Handling techniques. Use gentle handling, speaking in soft tones and avoiding abrupt movements to keep animals calm. Consistent routines. Establish regular feeding, cleaning, and monitoring schedules to create predictability. Environmental enrichment. Offer toys, scratching posts, or even scents to stimulate interest and reduce boredom. Reducing stress not only improves an animal's immediate well-being, but can also reduce recovery times and prevent complications such as stress-induced immunosuppression. Explain the concept of behavioral health in veterinary medicine and outline why it is essential for ensuring animal welfare in clinical settings. Answer: behavioral health refers to the psychological well-being of animals, encompassing their ability to express natural behaviors, avoid suffering, and manage stress. It is essential because quality of life. Maintaining behavioral health ensures animals are free from fear and distress, fulfilling a core component of the 5 freedoms for animal welfare. Safety. Animals with balanced behavioral health are less likely to display aggressive or fearful behaviors, reducing the risk of injury to staff and other animals. Recovery. Stress management in clinical settings can enhance recovery, as stress is linked to immune suppression, delayed healing, and increased susceptibility to secondary infections. Behavioral health is maintained by environmental enrichment, appropriate handling, and prompt intervention in behavioral issues. Why is the understanding of the bidirectional relationship between animal behavior and health critical in oncology nursing for pets? Answer: the relationship between behavior and health is bidirectional, meaning that an animal's physical illness can affect its behavior and vice versa. In oncology nursing, recognizing this link is crucial because stress and immune function. Chronic stress due to pain or illness can weaken the immune system, hindering recovery. Addressing behavioral signs of distress can improve the patient's overall health outcomes. Behavioral changes as indicators. Changes in behavior, such as lethargy, aggression, or decreased social interaction, can indicate worsening health or side effects of treatment, requiring timely intervention. Oncology nurses must assess both physical and behavioral symptoms to provide comprehensive care and enhance the quality of life for the pet. Mrs. Lewis's cat Bella has recently started displaying signs of stress, including hiding, decreased appetite, and excessive grooming. Mrs. Lewis is worried about Bella's behavior worsening. What steps should the veterinary nurse take to support Mrs. Lewis and improve Bella's welfare? Answer: the veterinary nurse should first reassure Mrs. Lewis and take a thorough history, including any recent environmental changes that may be causing stress. Next steps include behavioral assessment, evaluate Bella's environment and interactions to identify triggers, provide enrichment suggestions, recommend enrichment strategies such as vertical space for climbing and hiding, puzzle feeders and interactive toys, suggest gradual exposure techniques. If changes in Bella's environment, e.g. new furniture or visitors, are causing stress, gradual exposure to these elements can help reduce anxiety. Follow-up support. Schedule a follow-up to assess Bella's progress and offer additional support. Emphasis on environmental enrichment aligns with welfare standards and promotes behavioral health. Discuss how behavioral assessment is conducted in veterinary settings, particularly for animals showing signs of aggression, and the protocols for handling these cases. Answer: behavioral assessment involves observing an animal's responses to various stimuli to determine underlying stressors. Key steps include behavioral history. Gather detailed background information on the animal's behavior at home and any triggers for aggression. Observation in clinic. Monitor the animal's response to different people, noises, and handling to identify specific stressors. Safety protocols. Aggressive animals should be handled with safety equipment, such as muzzles or barriers, to protect staff. Results guide the design of individualized management plans, including desensitization or counter-conditioning techniques.